From KARE11 News, this is Extra Extra.
Good evening, everyone, and welcome once again to KARE11's Extra Extra. I'm Paul Majors.
And I'm Diana Pierce. If you're a little thin on top, don't despair. Tonight we'll meet a guest who underwent a hair-raising experience, which he says was the best decision of his life. Here's Mark Daly with Gone Today, Hair Tomorrow.
When it comes to hair,
Long, beautiful hair.
some men have it, and others don't.
Give me down to there.
Until recently, those with a little less on top had few options. Now, there's an increasingly popular choice. Hundreds of hair transplant surgeons were in Las Vegas this year for their annual convention. And while they were here, they were supposed to learn about the latest techniques and newest procedures.
We're going to try to do 1,250 grafts.
Also at the convention, Dr. Ron Shapiro demonstrated one of the newest trends in hair transplants on a Minneapolis patient, Howie Pindyke. By implanting just one hair at a time instead of big plugs of hair, the doctor hopes to give Howie a more natural look. Here's Howie before the surgery with a friend at Mystic Lake Casino, and after in Las Vegas, looking forward to his new hair growing out.
Having hair in my head and not being insecure about people looking at my hair will definitely help me. It should help me find a girlfriend. But, you know, I think overall it's just part of my self-esteem, and I think it'll be real good for me.
Back in Minnesota, Dave Peters is another of Dr. Shapiro's patients who underwent the new micrograft surgery. Here's a close-up of what Peters looked like before and now after.
It's certainly helped my self-confidence drastically. I feel good about the way I look.
But even Peters warns there are a lot of bad hair transplants out there, and the key to getting a good one is finding a qualified surgeon. Otherwise, you might be better off investing your money in a nice hat.
Well, here's one guy you won't see wearing a hat anymore, Howie Pindyke, who you recall from the story, had a hair transplant a year and a half ago. Welcome, Howie, to you. Also joining us is Dr. Ron Shapiro. Welcome to you, too, Doctor. Howie, let me ask you just right out. What has this done for you?
Well, without a doubt, having hair makes me feel a lot more confident and self-assured. I don't feel like people are looking at the top of my head as they're trying to see how far my bald spot goes back. So that helps me a lot in business and personal as well.
Sure, so your self-esteem is way up there.
Oh, yeah, for sure.
You ever just look in the mirror, sort of wonderment, and go, wow?
Yeah, for sure. Especially when I think I look about 10 years younger.
Right.
That's what I was looking
Well,
at.
you were in Ace Ventura, right? Pet Detective?
Yeah. Had a small part in the original Ace Ventura.
Uh-huh.
And at that time, my hair was pretty much back here.
Uh-huh.
So now I'm hoping maybe I can get some better parts and less thug parts these days.
Well, it really does look good.
Thank you.
In all sincerity. Now, Doctor, tell me about this. I know we have some videotape that you've brought of a procedure, so maybe we can take a look at that and you can describe it for us.
I'll be happy to. If basically, here we have the tape. This is the donor area where we take the strip out from. We're injecting it with Novocaine right now to numb it up. What we'll do is we'll take a strip out from the back there, and then that strip is given to the nurses, and they dissect that strip into very small pieces. The donor area is sewed up, and you can see that you can't even see it anymore. After it's sewed up, you can't even tell that anything was done. Meanwhile, like I said, the strip is cut into very tiny little individual grafts. And in the next shot, I think you'll see that the grafts are separated to 1s, 2s, and 3s and 4s. They're totally separated.
So one means one hair?
One hair only.
Wow.
And you can see those are one-hair grafts that are being put in the hairline, one at a time, very close together, about 1 millimeter apart. This is really the crux of the whole procedure, where by putting these hairs so close together and so tiny, they just basically mimic a natural hairline. So you can't tell the difference between that and a natural hairline.
Well, let me ask you a question I always ask anytime I see something like that. Painful?
To tell you the truth, surprisingly, no. Surprisingly, no. Other than a few needles that they use to give you local anesthesia to numb out your head, once you have the local in, you feel nothing at all the whole surgery. Even afterwards, which you have pain medication prescribed, luckily enough, I didn't need to take any.
Right.
Yeah, which was...
And how long does it take for the For everything to be normal, I guess, you know, for everything to heal and all of that.
It usually takes about a week and a half before the grafts look fairly normal. By the end of 3 weeks, you can't even tell anything was done. I mean, the scabs fall off, and these are so tiny that it's almost impossible for me to see it. Then he looks basically the way he looked before surgery. At about 3 months, the hairs start to grow. Between 3 and 6 months, you see a significant aesthetic change, and you get continued improvement up to a year. By the end of a year, what you see is what you get.
Now, I know you brought some pictures with you, too, before and after pictures, and they're fairly dramatic, so maybe we can take a look at those now. You can tell us what we're seeing.
Okay, this is Howie. Right on the left, you see, on the before picture, that's actually 1 day after surgery. So you see what the procedure looks like, how clean and how well it heals even 1 day after surgery. And the next one is about 6 months later.
Howie, you look great.
Thanks.
This picture here is a good example. This shows the pattern that we try to follow. We try to put all the 1 hair grafts right in the front there. We try to put 2 hair grafts a little bit further back, and then the 3 to 4 is in the middle. And what that does is that mimics nature. It makes it, you can see the pattern drawn and then the incisions made. And this is actually after 2 procedures. About a year and a half later, you can see how natural the hairline looks. And this is a third patient who you see him before surgery. You see about 1,200 grafts right after surgery, and then you see him about 8 months later. This shows corrective work. On the left, what you have is the larger plugs, which can give the pluggy look. That's what hair transplants used to be associated with.
Right, exactly.
The large plugs didn't have to give a pluggy look, but when people didn't finish the procedure, or if it was done in other people who didn't know what they were doing, then it would give it. But you can correct it very good, as you can see.
By going back in with the single hairs.
Single, 1, 2s, and 3s. Yeah. So it's nowadays it's really good. It's very rewarding because there's no longer a need to have an unnatural look with hair transplantation if you use the proper procedure.
Oh, it really is interesting.
Yeah. So it's very nice.
I want to thank both of you for being with us tonight, and Howie, good luck on the big screen.
Oh.
And if you get stuck playing thugs, at least you'll be a thug with hair.
Oh, that's true. And I'll get a love scene in there once in a while.
Perfect, perfect. Stay with us. There's a lot more ahead on Extra Extra. We'll be right back.